The following segment is sponsored by Intermountain Healthcare.
On this Valentine's Day, we are celebrating heart health. Ask the experts. You can ask the experts anything about your heart health or any concerns. They're all here taking your calls. We have Maylee. I've lost your last name.
Taylor.
Maylee Taylor. Okay, thank you so much for coming in. We're going to talk about blood pressure and why it's important not only to get it checked at your regular visit, but to keep an eye on it and make changes if you need to.
Yes, absolutely. So monitoring your blood pressure is really essentially very easy to do. Your primary care physician will follow it, even your dentist office will track your blood pressure. Any pharmacy will take your blood pressure. You can purchase a small machine to have at home and monitor your blood pressure.
If it's a concern, you might need to.
Sure.
Okay.
Blood pressure is one of those things that you don't ever check once and it's a one and done kind of thing.
Yeah. No.
It's something that you always want to be monitoring. Even if your blood pressure is good, you want to keep checking it and make
sure it's good. You want to take mine?
I would love to.
Okay, now I just got nervous. Will that change it?
No, it might a little bit, but it's okay. So your blood pressure is the easiest way to understand what your blood pressure is it's the amount of force that is reflecting on the circulatory system.
Okay, so how fast and how strong your blood is pumping through.
Yep, so what happens is it consists of two different numbers, and we'll get them here in a moment. There's an upper number known as your systolic and a lower number known as your diastolic, both equally important.
Okay.
The upper number is the pressure within the circulatory system while the heart is squeezing or contracting blood out of it. And the lower number is the amount of pressure when the heart is relaxing.
Okay.
So why is that important?
Why is that important?
The more pressure that your heart has to pump against, the harder your heart is going to have to work.
Okay.
Which will lead to coronary artery disease, things like heart failure.
But there are things you can do to change it and work on it, and medications.
Medications.
So I was high, huh?
Yep, but you know, you were nervous and you know that you're getting your blood pressure. The other thing to remember is your blood pressure is meant to fluctuate with your body's needs. So it's going to go up and it's going to go down.
When you're nervous, your heart's going to be pumping a little bit more.
Yes.
When you're sleeping, it's less.
And we want it to be less. Normal number would be 120/80. That's what we'd like to see your blood pressure, or lower. Anything above about 120 to 140 is what we call pre-hypertension or kind of pre-high blood pressure.
Okay. We're already out of time. But if you have any questions, if you've gone to the pharmacy and had your blood pressure taken or your doctor's office, any questions, these are the experts here who can answer your questions. They'll be here taking your calls, or you can go on social media and use the hashtag KUTV Ask the Expert.